How are the gloves doing?
Oh, they help. At least he's not drawing blood when he scratches his face.
Baby eczema is often used as a catch-all phrase to include a lot of different skin conditions that cause dry skin, particularly in young babies. Eczema itself is a condition that is chronic. It's a chronic illness that you suffer from your whole lifetime, but it gets worse and better depending upon the time of year. And at different ages, it's a little better for you than it isn't.
One thing I've noticed is our older son had eczema as well, but his seems much worse and has lasted much longer. Is that common?
Well, it definitely runs in families, and every individual is different. So one person will certainly have it more severely than another person, but a lot of times it gets more mild as they age. It's an inflammatory reaction of the outer layer of skin, the epidermis. It often is caused by a family history of what's called atopy, and atopic families are those that have running in the family line asthma, food allergy, seasonal allergies, and hay fever. There's no way to prevent it, and it's not contagious in terms of one baby having it is not an indicator at all of another stranger baby getting infected by it. There's absolutely nothing about it that's contagious.
So it's sort of
a lot of times it occurs on the flexor areas of the skin.
So if you look underside.
Behind the knees is a common area. The treatments typically for it are keeping them well moisturized by using lubricants that are over-the-counter moisturizing creams.
Up till now we've only been using the aquaphors and things like that.
Well, basically you want to avoid soaps and detergents that are going to be harsher on the skin. There is, in general, in the winter time, 2, 3, sometimes 4 times a day you want to lube them up with an aqueous-based cream, so more moisturizing creams. Sometimes the ointments people prefer, most people don't because they're greasier. They do last a little longer. It depends on the sources that you read. Some people will say do it lubricate the child head to toe twice daily. Others say 3 to 4 times a day in the worst seasons for them. That will give them temporary relief. There is debate over bathing. Some different, like the dermatologic societies and some eczema societies dispute whether a daily bath is a good idea. And I think it's dependent upon your child. It's not that you're really medicating a child with eczema. Once they're over 2, you can start treating them with certain antihistamines and other anti-inflammatory medications. When they're very young, you typically won't use any medications by mouth unless it's so severe, and then normally that's administered by the dermatologist, but it's really infrequent that anyone is that severe that they need a medication by mouth like an oral steroid to control their eczema. You'll have it for life, but to different degrees of severity. Some people, all that amounts to is they get cracks on their hands in the wintertime as they age, or they get dry lips throughout their lifetime. It really depends on how severe it was early on. Some people really severely suffer from it throughout their lifetime, and they need to be put on oral medications, but that would be a smaller percentage. Yeah, but he's going to be fine.